Yeah. See, whenever you see a patient in the emergency department, suppose a young male had a road traffic accident. He is traveling on a two-wheeler, for example, bike, and he has come to the ER, and his GCS is 15/15, and he is a stable. He's stable. So it's a stable trauma patient. All the vitals are stable, and you have a suspicion of uh, like maybe his cervical spine got injured, and you want to know whether he is having any cervical spine injury. So there is an approach for that cervical spine injury to get ruled out. So basically we have two screening tools two screening tools for this approach. Number one is Canadian C spine rule, and the second one is nexus criteria. So what is nexus criteria? National emergency X radiography utilization study. So we will be discussing about these two tools. Basically these are the approach to the cervical spine injuries. Yeah, first we will be discussing about Canadian C spine rule. Right. So in Canadian C spine rule, we will follow the algorithm. So you have to remember this algorithm. So number one, what is there? There are high risk factors, like high risk factors. So number one is age more than 65 years. Age more than 65 years. Number two, dangerous mechanism of injury. And number three, paresthesias in extremities. So if any one of these three are present, any one of these three high risk factor is present, you have to directly do CT C spine. So you have to directly do CT C spine. And what is the dangerous mechanism of injury? For example, fall from more than or equal to 1 meter height or 5 stairs. Number two is axial load to the head. So person have fell down from height and directly landed on head. And number three is motor vehicle collision. In motor vehicle collision, maybe the patient is traveling in a vehicle, in a car which is more than 100 kilometers per hour. Otherwise, and rollover of the vehicle, and then ejection from the vehicle. So during accident, the patient got ejected from the vehicle. So these are the dangerous mechanism of injury. So if these three are present, you have to directly do CT C spine. And if these three are not present, suppose the above three factors are not present, so what you have to do? You have to go with the another set of factors which is called low risk factors. These are the low risk factors. So the low risk factors are: number one, simple, rare and motor vehicle collision. So patient is going in a vehicle and there is a simple collision from backside. And number two, patient is in sitting position. Patient is in sitting position in the emergency department. And number three, he may be ambulatory at any time. He will be moving here and there. And number four is delayed onset of neck pain. So delayed onset of neck pain. And number five, there is no midline cervical tenderness. So these are the five low risk factors. Okay. Number one is simple, rare and motor vehicle collision. Number two, sitting position in the ED. Patient will be in sitting position. And patient is, number three is ambulatory at any time. Number four is delayed onset of neck pain. Initially he won't be having any neck pain, and after some time he will be complaining of neck pain. And number five, there is no midline cervical tenderness. So if any of these five factors, any of these five factors are not present, you have to do CT C-spine. If any of these five factors are not present, you have to do CT C-spine. If any one of the factor is present, if any one of these low risk factors is present, again you have to go to one more criteria, that is patient able to rotate neck actively 45 degrees left and right. So you ask the patient to rotate the neck to left and right, and if the patient is rotating his neck comfortably, you need not do CT C-spine. If the patient is not able to rotate, then directly go to CT C-spine. So this is the Canadian CT C-spine rule. So in Canadian CT C-spine rule, there are three high risk factors, which is age more than 65 years, dangerous mechanism of injury, paresthesia and extremities. If any of these three risk factors are present, you have to do CT C-spine. And if not present, then you have to go to low risk factors. There are five low risk factors: simple, rare and motor vehicle collision, sitting position in the ED, ambulatory at any time, delayed onset of neck pain, there is no midline cervical tenderness. If any of these factors are not present, then you have to go with CT C-spine. If any of these five factors, low risk factors, are present, then you have to go to another criteria, which is whether the patient is able to rotate neck actively 45 degrees left or right. If the patient is actively able to rotate his neck, if it is yes, then you need not do CT C-spine. If the patient is unable to rotate, then you have to do CT C-spine. And the next one is nexus criteria. So in the nexus criteria, there are 5 points. So number one is no posterior midline cervical spine tenderness. No posterior midline cervical spine tenderness. And number two, no evidence of intoxication. Maybe patient, maybe he has taken alcohol. And number three, normal level of alertness. So normal level of alertness means maybe the patient is having GCS of 14 or less. Sorry, normal level of alertness. This one I will be discussing later. And number fourth is no focal neurological deficit. So focal neurological deficit. Focal neurological deficit is maybe one hand or one leg is not functioning. For example, simple example. And fifth one is no painful distracting. No painful distracting injuries. So what is the distracting injuries? Distracting injuries is like patient may be having, for example, long bone fracture. Patient will be having some, for example, a femur fracture, which is causing more pain, and this pain will be sufficient to distract the patient from a second injury like neck injury. And one more example is large burns, and the other is any large laceration or any crush injury. So these are the common distracting injuries. So if these five are present, then there is no requirement for CT C-spine. If these five are not present, no, then you have to do CT C-spine. Right. And I have told like normal level of alertness. For normal level of alertness, generally we don't do CT C-spine. Suppose instead of normal level of alertness, he is having altered level, like altered level of alertness. Altered level of alertness like GCS of 14 or less, and disorientation to time, place or events. And one more thing, evidence of sorry yeah sorry it's not evidence, like inability to remember three objects at 5 minutes. If he's having inability to remember three objects at 5 minutes, then definitely like you have to do the CT C-spine, right?